Well, the original trial was a registration trial, and so it was randomized and had two different dose levels, which was important because we want to make sure that we get the highest efficacy with the least toxicity. And so when we reported the original results, the follow-up was not that long. It was long enough to ascertain the endpoint, but we really didn't have long-term data. And as I think many people know about chronic graft-versus-host disease, this is a disease, for which we really have to treat patients for a long time. The average time of treatment is between 3 and 5 years. And so it's very important to continue following these patients and to know what eventually happens to them. So the abstract I'm presenting at this meeting is about 3 years of follow-up, so almost twice as long as the original report. And it really shows that, patients continue to do well. We are not seeing, cumulative toxicity. Patients seem to be tolerating their doses. They're also able to taper off some of their immunosuppression drugs, and they don't need to go on to other treatments, which is important. So I think it supports and extends the original findings. I think the major one is the one I want to emphasize, which is that we didn't see any new safety signals, which I think is really important when you're giving a drug, for a much longer period of time, still very well tolerated. We did see, slightly increased efficacy, but that most of the efficacy we had already seen in the original study. And then again, I think I just want to emphasize that we did see that some, not a whole lot of patients, but, almost 10% of patients were able to continue on the drug for up to 3 years. And that also, quite a number of patients were able to stop other immunosuppressive agents, which is one of the goals of our therapy, which is to minimize toxicity from other agents. These data are very reassuring. We do have to remember that it is a long-term follow-up of the original clinical trial. So it's not real world data in that sense. And so the numbers were sort of limited, although we had slightly more than were in the original report. But I think, it's very important as clinicians, when we're seeing these patients, we always have to be vigilant, for side effects, but I think it's very reassuring to be able to counsel the patients that, yes, if they're on it for a long time and obtaining benefit, it does look like it's safe and efficacious to continue to do it. And also, as we saw most of the toxicities that we saw were early on, and if patients can get out 2-3 years and not have toxicities, the chances of them going on and developing additional toxicities is low. Well, I think as our field, and anyone who takes care of these patients knows, it is a long-term treatment for these patients. And so it's so exciting to see, this drug, Rezurock, as well as other drugs, being approved, because it means we have many more options. I've been in this field for a long time, and I remember when we pretty much only had prednisone and things that had lots and lots of toxicity. So it's extremely, it's very exciting, I think, for us to be able to have these to offer to patients. We are continuing to pursue new drugs because not everybody responded. Sometimes people initially respond and then lose their response. And so we'll continue to need new, more effective and less toxic drugs. I think we're also, as a field, interested now in, treating a little earlier so that we can spare patients from having to have bad side effects and then kind of play catch up to try to treat them. It would be nicer to prevent them in the first place, or know someone's going to be getting something, when they first get chronic graft-versus-host disease, to treat them effectively so that we can really minimize the morbidity and the mortality. Because, these patients, many of them are cured of their underlying disease, and it really is tragic to have left them with, another disease that they're going to have to contend with for a long time. I would like the nurses to know how critical they are in terms of our patients with chronic graft-versus-host disease. These patients have, they didn't often know that they were going to get this complication. And I think that relationship with a nurse who really knows them and can counsel them and can help, coach them through these therapies and keep contact with them, sometimes even more than their physician, is really challenging. So the other message I guess I would send to the nurses, since I know this is going to be posted on the nursing website, is just that to thank them from the physician standpoint, because we know how important they are in this team approach to taking care of these patients. Patients are really complicated. They're on a lot of meds, and the nurses really know their patients very well, and so we appreciate it.